It took us 400 administrative hours just to prepare the paperwork that we had already prepared once before.
Joseph Tuardi says that federally mandated process cost his agency several $100,000, multiplied by several hundred agencies in the state. New York pays them, and you pay New York.
It does get passed on to the taxpayers and the patients.
Tuardi says 3/4 of the state's nonprofit home health agencies are, like his, running at a deficit. With fewer nurses available to make home visits, patients would stay in the hospital longer. And if they're Medicaid patients, you would pay for it again. So in the end, New York faces a difficult choice. Pay the claims or pay for an expensive appeal to Washington's Center for Medicare and Medicaid Services, also known as CMS. Once CMS reviews all that paperwork, it renders an initial decision. That's generally followed by another review and then a final decision. And sometimes, step number 5, an administrative law hearing. And who's paying for this complicated and lengthy process? The providers, the state, and you, the taxpayer. It turns out New York recently tested a more streamlined system, one that analyzed a small sample of claims instead of the estimated 30,000 that are disputed each year. But that program has a shelf life, and CMS claims only Congress can extend it. New York Senator Kirsten Gillibrand says she's advocating to make it part of the bigger reform legislation. You said you would like to include it in the health care reform bill, but does that poison pill its chances given how controversial health care reform has been?
Not necessarily. There are a lot of good ideas on the table, and right now we're trying to pull in the ideas that will win bipartisan support, but everybody wants to find ways to cut costs. Is there anything else that you can do to try to save New York this money that we're apparently hemorrhaging on a daily basis?
Yes. We are trying to get an FMAP proposal passed. And in the FMAP proposal, there would be the ability to stop this kind of bureaucracy. Sending all these forms to Maine, having it cost a ton to simply process, doesn't bring anybody better health care.
Joseph Tuardi says it needs to change before agencies like his run completely out of money. Steve Flemish, CBS 6 News, Niskayuna.